Hello and welcome back to Blue Fig Longevity. In this channel, I'm going to teach you what I've learned from years of medical practice and medical research, and more importantly, what I've learned from my older patients. We're talking about patients that are older than 80s, 90s, but instead of laying in a nursing home or living in a hospital bed, they're actually still working, they're still active, they're still vibrant, they're alert. They are, by definition, living a life of longevity. On this channel so far, we've been reviewing all of the lifestyle changes that you can control. Things like eating a colorful diet, getting a good night's rest, and staying away from stress. Today, let's take a look at the most overlooked and probably the most powerful modifier for longevity. Let's talk about exercise. But first, I'd like to talk about the ill effects of not exercising and what those effects have on your body long term. So, when you're not moving around, you're not able to get blood flowing to all of your vital organs. That's what we call lack of circulation. And when you're not getting blood to the vital organs, tissue starts to have ill effects. It doesn't get oxygen, and so it can't function properly. And you get cellular inflammation, and you get problems with the ways the cell works. So you can't produce normal hormones like insulin or cortisol. So that causes all of the damage we see. As you can see from the diagram, there are a lot of poor effects that happen from lack of movement. You can have problems with your brain and your nervous system, problems with your gut and how you digest foods, problems with your immune system. You can become more susceptible to infections. And this happens at the cellular level, all the way down to individual cells in your body. Inside each of our cells, we have a little organelle called mitochondria. The mitochondria in each of our cells is the powerhouse for the cells. So when the mitochondria is not working correctly, the cells get tired, they get fatigued, they can't function properly, they can't work. I'm Dr. Farrukh, and I've been taking care of patients for over 20 years. Let me tell you about one of my patients. We'll call him Mr. B. Mr. B was a Vietnam era veteran who was a paratrooper in the military. And that means he jumped out of helicopters and airplanes thousands of times while he was in the military. And as you can imagine, all those jumps had effects on his lower extremities, on his knees. His knees were constantly being jarred by landing on the ground. Over the years of jumping out of planes, his knees got severely damaged and got to the point where all of the cartilage had worn out in his knees. He was what we call bone on bone when it comes to the damage in his knees. That caused him pain every time he would take even the slightest steps. And over the years, the lack of activity made him gain weight because his appetite didn't change. He just wasn't moving as much. By the time I met him, he was over 300 pounds, very overweight. And he was complaining of not only his knees hurting, but now his thighs hurt, his back hurt, his neck hurt. His whole body was in pain. And that made him not want to move even more. To be honest, I was worried about him. I didn't think he had a very good prognosis. He wasn't that old, but he was pretty much bedbound. To move around, he relied on crutches, but even that was painful for him. So many times he used wheelchairs. Remember, he really didn't have any problem with his joints. It's just that his joints were worn, and because he wasn't moving around, they were just getting fatigued and inflamed and just causing pain all the time. So to help Mr. B, I recommended several things to help him to lose weight and to improve his lack of activity. We started out very slow and very small. Now, I know the textbooks say you're supposed to exercise for 30 minutes a day, most days of the week, and to use weights, strenuous activities. And I know the textbooks say you're supposed to do that a couple times a week. Of course, that's where we wanted to go, but I knew he wasn't going to be able to start there. So I asked him, I said, Mr. B, do you check your mail? And he says, yeah, I check my mailbox. It's up in front of the house at the end of my driveway. I said, okay, I need you to check the mail 2, 3, 4, 5 times a day. Next, I asked him, do you have stairs? He says, yeah, I live in a 2-story house. I said, okay, I need you to go up and down the stairs 2, 3, 4, 5 times a day. I need you to go as often as you can, even if you don't need to go upstairs, even if you don't have to check the mail. I want you to start moving around. Just do those few little activities that you normally do, but do them more often. When it comes to strength, I said, do you have any empty gallon jugs of milk at home? And he said, yes. And I said, okay, fill those up with water, tape them up at the top, and they become dumbbells. You don't have to go out and buy any, but just start using those empty milk jugs filled with water as 5-pound weights to do biceps and maybe presses to increase your activity. It's these simple things that I asked him to do to get his physical activity back up to a more normal range. As his activity got better, I asked him to do more. So I then started asking him to do regular body weight squats. And those are simple to do. You act like you're sitting in a chair, but then you get back up. And I asked him to do 10 of those at a time, as many as he can throughout the day. And then when he got even better, he eventually bought a treadmill. And then I asked him to put the treadmill in his bedroom, wake up, drink a glass of water, and then walk on that treadmill at a comfortable pace for about an hour each morning. Start his day that way. It's important to drink the water because we're slightly dehydrated when we wake up in the mornings because we haven't been drinking all night. So it's important to drink the water and then to do 1 hour of what we call moderate cardio exercises. And ironically, I actually learned this from other patients of mine that are bodybuilders. Whenever they are getting ready for a competition, a few weeks before they go for the competition, they are doing what we call fasted cardio. It's important to drink water, so you have to drink water. But other than that, they don't eat anything. They don't have any protein powder. They do what's called fasted cardio for 1 hour every morning. And that gets them what they call shredded. For Mr. B, we didn't need him to get shredded. We just needed him to offload some of that extra weight that he had gained after all those years and to help him with his joints. Sure enough, over the subsequent months, he lost weight. He got down to in the low 200s, so lost over 100 pounds of weight. His joints felt better. His back felt better. His neck felt better. He started out slow and worked his way up. So let me ask you, what are you willing to do? What kind of activities do you prefer to do? Did any of those activities that I mentioned with Mr. B resonate with you? If so, please comment. I'd like to hear. Or if there are other activities, simple activities that you have found to be helpful to get you more active, to get you to lose weight, to maybe help you reverse having high blood pressure, high cholesterol, diabetes, I'd love to hear from you. If you found this video helpful, please like it, please comment, please consider subscribing, and please share it with someone that you think might benefit from this advice.